Good morning and welcome to the webinar. My name is Lauren. I am the Continuing Education Coordinator here at Alzheimer's Orange County, and I will be your host today. Thank you for joining us for today's topic on navigating assisted living and dementia care. Finding the right care for a loved one can be complex and challenging. Often it can feel like there are too many choices available, while at the same time, not enough is known about each of these choices. Our webinar today is designed to equip you with the knowledge, skills, and resources necessary to navigate this intricate landscape with compassion and confidence. Today, our presenter is going to be Ann Allett, CEO and founder of Memory Care Support. Before we begin, a few reminders. Your mic and video are automatically disabled and will remain so throughout the presentation. Any questions you have for the presenter, please type into the chat box located in the taskbar. We will save your questions and answer them at the conclusion of the webinar. A copy of the PowerPoint will be emailed out to you at the end of the webinar. And lastly, we ask that you please complete the survey at the end of the webinar, as it helps us to continuously improve our webinars and let us know what you would like to learn about in the future. So I'll go ahead and do Ann's bio. Do you want to switch to the next slide, Ann? Thank you. So Ann
Allett, have it memorized.
Ann Allett is a certified nurse practitioner and gerontological nurse, a dementia specialist, educator, author, and speaker who continues to learn from persons living with dementia. For over 20 years, Ann has advocated for innovative and dignified support for people living with dementia. Her book, Getting Dementia Care Right, was published by Health Professions Press in 2023. As founder and CEO of Memory Care Support, Ann specializes in assisted living, long-term care, and memory support care operators across the country to develop best practices for innovative environments in dementia care. She is the author of the Best Life Approach for the Greenhouse Project for supporting persons living with dementia. Ann received a Bachelor of Arts in Social Sciences from the University of California, Irvine, and a Bachelor and Master's of Science degrees in nursing from California State University of Long Beach, and is a certified master gardener. Ann lives in California, and when not working, she's gardening or traveling with her husband. And Ann, I will now hand it over to you.
Oh, thanks, Lauren. And thanks all of you for joining us today. I'm here in Orange County, as I imagine many of you are, and I'm happy to see some sun poking through this morning. So here's hoping we have a couple dry days. So these are the questions that we're going to be talking about today. And I'm also interested in hearing your questions and your experiences at the end of the presentation. As a nurse practitioner who has specialized in dementia, I get a lot of requests from friends, neighbors, clients to help them choose what can be good care and meaningful care for their loved one living with dementia. And I think often people are given the diagnosis of dementia, and then they think that there's still going to be a relationship and some guidance from their medical provider. And often they're kind of cut loose to figure this really complex matter out on their own. So I hope that we can touch on some things that'll be meaningful for all of us. We're going to be talking about, can a person remain at home? That's something that I think many of us think about as we get older, is can I remain in my own home for many reasons, whether you're living with dementia or there's other debilities. When is 24-hour care needed? We're going to talk a little bit about the differences between nursing homes and assisted living. And I'll also touch on board and care. That's another type of residential environment. How can you tell if a residential care facility offers good care? And what type of questions should I ask before I make the decision to move a loved one in? That's a big decision. So navigating care, as I mentioned, it's really one of the most challenging aspects of having a loved one with dementia. Families agonize over this, trying to make the best decision and trying to find the best location, or if they're going to keep someone at home, what type of care can help support the person to live at home. When do you need additional care? And I'm going to talk about some of the many things that influence that decision. Um, will the care be at home, or will it be in a residential facility, such as a nursing home or assisted living or a board and care? As I mentioned, it's a surprise to a lot of families that once they get the diagnosis, that the medical team often kind of falls away and doesn't have a lot of recommendations or suggestions or guidance. They will continue to monitor, of course, for health matters, but they really do not get into making the decisions about where or what type of care is needed usually. And the other thing that makes it really so challenging is that there are no two families alike. There's no two individuals living with dementia that are alike. Everything is so individualized, and there are so many different factors to consider. So let's first talk about remaining at home, yes or no. And it's usually not a complete black or white decision. Most people start out, if my husband were to have a diagnosis of dementia, I would start out thinking, okay, how can I make our house safe, our environment safe? How can I support him to live at home? That's usually where most people think is, what can we do to support the person in home? But there's many different factors to consider. And I'm interested if some of you on the line can share some of your experiences on things that have helped you make these types of decisions. The physical and emotional needs of the person living with dementia, that's a big one. As I mentioned, every person is an individual. Is the person easy to take along on errands with you when you go shopping? Does the person sleep at night so you can also sleep at night? Are there other physical needs the person has? One family I was working with, when the father was diagnosed with dementia, he was also had diabetes. He was taking multiple medications a day. His wife, who was also older and somewhat frail, was having difficult managing all of these medications. So it's not just the physical and emotional needs of the actual person with dementia, but the well-being of the whole care team. Who is that care team? Is it going to be one person? Are there other family members that live nearby that are going to be contributing? Are there are you going to be thinking of maybe potentially hiring supplemental caregivers to come in and help at the same time? So who's on the team? And I really encourage people to think of it that way, as putting together your team. This is going to be a decision that's going to impact your life, going to impact your whole family. And it's hard for one person alone to assume responsibility. I was the nurse practitioner for many years out in what used to be Leisure World. It's now Laguna Woods. And I saw so many spouses there taking over the full responsibility for their spouse living with dementia, and how wearing it was on the spouse. They did not have any other family near them, and it was a big undertaking. Of course, finances. We all worry about finances. We all worry about maintaining and paying our bills. And that's a big factor. And that's a reason that many people first go to, I'm going to keep my mother at home. I can't afford for her to have care someplace else. So that's definitely something to consider, but hopefully it's not the only factor. And I'll talk a little bit about that as we talk about some of the other choices. The physical layout of the home. My neighbor across the street, a couple of years ago, his wife was diagnosed with Lewy body dementia. Any of you that are familiar with that, often a person living with Lewy body likes to be in movement, likes to move all the time. They feel better when they're pacing. They do. It's very hard to confine them or have them in a small space. And my neighbor's house has a lot of stairs. It's a fairly small house with different levels of stairs. And it was really hard to imagine how she could be safe in that house with so many different levels that she would have to navigate. So the physical layout of the house is something to consider also. Local resources, and I'm going to talk a little bit more about that, how that can really be a great supplement for you if you do have a loved one at home with living with dementia. What is going on in your community? What are other resources that you can pull in and utilize? And then you're going to see this, I'm going to mention it a couple more times during my presentation today. Often you think that you've figured out this plan will work, this is the best decision, and then something will change and you have to rethink, refigure, and go to plan B. So flexibility is always important as we talk about creating a meaningful environment and life for someone living with dementia. If you're going to live at home or considering keeping someone at home that's living with dementia, there are some many questions to consider asking. But if you've contacted a home care company, there are many of them here in Orange County that advertise that they do Alzheimer's care, dementia care, or even if you have a private caregiver that you've received a reference on and you're thinking of just hiring someone privately, there are some questions to ask, because caring and supporting someone living with dementia is very complex. Again, because that individual is going to be unique. You can't necessarily apply the same approach, the same method to caring for everybody. And training into communication styles, how to approach someone, how to help them with their bathing, nutritional needs, all of these take some training. So some good questions to ask if you are talking to a home care agency or even a private caregiver is, how long have they been doing this? Especially if you're talking to a home care agency, there's a lot of new ones that have started up. And so how long have they been in business? Can they give you some references? I always want to ask for that. I want to hear them describe what kind of training do they give their staff so that person will be prepared to come in and help support your loved one. What is the training? Often they'll receive training on how to do transfers from the chair to the bed, or safety training like that. But to care for someone living with dementia, it's much more complex. And so you want to know that they've received training in communication styles. You want to know that they've received training in what to do if the person's mood changes and they seem to become anxious or angry. What's their training? How are they going to approach that person? I like to have them say, tell me about someone's life that you've made better through your staff interventions. Tell me a success story. Whose life has been made better by having your caregiver, your staff there. And also you want to know what type of supervisory oversight is there. If they send a caregiver out to your home and there's not any interaction, communication, or even on-site oversight from a supervisor, I think potentially there you're not getting the full professional support that you might need. You want to know also what's the minimum and maximum number of hours they'll come out to the house. Many places will not send someone out for less than 4 hours. If you're looking for someone that maybe is going to, what they call a live-in, they're going to be there 24 hours. Do they have that type of care? Do they change the staff every 12 hours or every 8 hours, or is it one continuous person? What do they charge? It's for those different lengths of stay. Can they come 2 days a week? What is it that you're looking for that's going to best support you and your loved one living with dementia? I encourage you, whether we're talking now about home care, but I always encourage you also, if you're looking at assisted living or a nursing home, you want to talk to more than one place if possible. Hopefully you don't want to wait till it's a time of crisis. People think, oh, if my sister gets is diagnosed with dementia, I'll just bring in a caregiver to help her. Well, it's complicated, and you want to know. You want to interview a few places ahead of time to really get a sense of, do they feel comfortable with the type of needs that your sister will have? Are they able to meet those needs and come on a regular basis? Again, are they insured? All of these questions you want to investigate before you sign a contract. I want to give you a couple examples of home care. My friend Susan is a real success story, I think. Her mother lived in Los Angeles in a very large and spacious house there. My friend Susan was actually working in New York City, and she was the only family member for her mother. So when her mother was diagnosed with dementia, Susan didn't want to move her mother out of her house. She'd lived there for many decades and was also very connected to the community. She had neighbors and friends. She was an artist in the community, so she was connected to the art community there. She felt very comfortable in her house. So my friend Susan came out to California and put together kind of a care plan for Susan, for her mom. And she did get in round the clock care. She had, her mother had long-term care insurance, which made that financially possible. And many people don't have long-term care insurance, so this might not be an option for everyone. But Susan really looked at all the resources she had. She talked to her insurance company, and they were able to arrange full-time care for her mother. But she didn't just want her mother to be alone in her house with the caregiver. She really wanted her to continue to have a vibrant and meaningful life. So to get working together with the caregiver, she also looked at what was available in the community, the larger community, and kind of put together a schedule of activities for her mom that the caregiver would be able to accompany her to. So her mother continued to go to yoga class for many months, once a week. She continued to go once a week for a walk in the park that she had done. That was part of her routine for many years. She continued to go and go to the pottery studio. And even though her abilities changed, it was still a wonderful experience for her, and a very tactile and sensory experience for her mother to continue to work with clay in the pottery studio. She had a garden at home, so the caregiver would take her mom to the nursery, and they would do expeditions out and buy plants, and together they would work a little bit on planting some plants. So those were examples of how Susan used community resources, and the plan would change. Susan would come out every 2 or 3 months, and they would talk together with her mother and the caregiver and kind of revamp the plan. But she was able to use a lot of community resources to bring meaning to her mother's life, and not just keep her confined to the home all day. Another example was a client I had, Gary, whose wife was diagnosed with dementia, and he was very devoted to her. And he said, no way am I ever going to consider that my wife isn't going to live here with me. I'm going to take care of her in the home. And when I said to him, you have to think about your own health and your own well-being, and what are you going to bring in to help you? And he was understandably very loving, very protective, but he did not want to bring in any extra help. And as I continued to visit and work with him over a couple of years, I saw his own health decline. He was exhausted. His wife didn't sleep well at night. He was worried about her getting out, so he had multiple locks on all of their doors. He had groceries delivered. So, as it happened, not only was his wife being confined at home, he was also being confined at home. So finally, he had a fall, or he became injured, had to go in to the hospital for a couple of days. And at that point, he was willing to consider that this probably wasn't going to continue to work, and he needed either some supplemental care in the home, or he needed to look at his wife going into some kind of residential care. So again, I know every situation is unique. Every family and person on this call has had a unique experience. But I encourage you to, even when you think this is something you can do yourself, to start looking for resources that can help support you as well as your loved one living with dementia. All right, I'm going to touch now on assisted living versus nursing homes. And probably most of you are familiar with some of the differences and the similarities. Nursing homes have been around for really since the early 1900s. It's where frail older people often went at the end of their life. It is based on a medical model, kind of based as maybe a step down from the hospital version. There are nurses required around the clock in nursing homes, which can be a good thing. But it's also much more the medical model, in the sense that it wasn't designed to be maybe a home-like environment, but it was designed to be more of a clinical environment. So in terms of nursing, as I said, nursing homes are required to have around-the-clock nurses. Assisted living, 20 years ago, very few of them had nurses on site around the clock, but now more and more of them are having nurses, or they have nurses there for 8 hours a day. So that's something to think about. What are the medical needs of someone that you're considering having live in assisted living versus nursing homes? But many assisted livings do have some nursing now, and that's something to when they say they have nursing, what does that mean? Do they have a nurse supervisor in the area that's called when there's a problem? Or do they have a nurse that's actually there physically on site? Do they have multiple nurses? Do they have nurses 7 days a week, 24/7? Or is it just 5 days a week for 8 hours? Because of state regulations allow this to be unique to each company that's running the assisted living. You need to really ask questions about that if you're considering that. Social model. As I said, nursing homes were designed to be clinical. Often they had the big nursing station. You'd see a lot of medical equipment in the hallways and in the rooms. I can gratefully say that a lot of the newer nursing homes now are trying to go away from that type of clinical environment. They're trying to make it more home-like. You don't see, the uniforms so much. You don't see as much medical equipment. You see more comfortable furniture. Often there's outdoor patios, but it will vary from nursing home to nursing home. Some of them are still present quite clinical. Assisted livings, they do not say that they provide medical care. They will be very quick to tell you that they're a social model, meaning that they are trying to provide more of a home-like environment. You often walk into the assisted living, you see a nice, comfortable lobby area with couches. There's TVs around. They have activity rooms. Almost always they have nice outdoor areas. So the appearance can be different. But I think you have to you have to tour and look at each place. As I said, some nursing homes now have really changed their environment, and they're really very comfortable and very nice. So you have to tour to see that. Private pay versus Medicaid nursing homes. If you're going to live in a nursing home long term, and remember, a nursing home and Medicare will not pay for you to live in a nursing home. They will pay for you to go to a nursing home for rehabilitation after an accident or after a hospitalization. Usually that's for 2 to 3 weeks maximum. They will not pay for you if you need to live there in a nursing home. That will either be private pay, or some nursing homes do accept Medicaid, and where you have to spend down a certain amount of your assets and then can apply for Medicaid. Assisted living is almost always private pay. Some of them do accept Medicaid though, but they're much fewer of them do accept Medicaid. And federal oversight, I think it's the nursing homes, they have federal oversight over CMS, and that's the agency that oversees Medicare, oversees a lot of health agencies in such as hospitals and stuff in the United States. So the nursing homes across the board, no matter what state you're in, are going to have federal oversight. Assisted living, there is no federal oversight over assisted living. It varies a lot from state to state. Some of them have very kind of strict state agencies that come in frequently and monitor, and some states have very loose oversight. California, and I will put up the information on how you can look this up. California, their state agency that oversees assisted living, they're understandably, they're understaffed, and they're not monitoring and visiting and doing regulatory visits as often as they were a few years ago. Factors to consider when you're looking at nursing homes and assisted living. And I also just want to talk a little bit about board and cares. Board and cares fall under the assisted living type of state regulation. And these usually are homes, private homes that have been made into environments to take in frail elderly. And usually there's a limit of 6 people that can reside in one of these homes. So in your own neighborhood, there might be a private home that has been turned into what we call a board and care. And they can also, in the bedrooms, often they will have 2 beds in a bedroom, and then they're using the living room as a common area. They will have live-in caregivers there around the clock, but usually not nursing. And but it can be a nice home-like environment for many people, and it can be less expensive than assisted living. But so they fall under the same regulatory guidelines as assisted living, but they're small homes. So finances, definitely something to consider if you're looking at residential care for a loved one. Nursing homes, if the finances, if you've had them looked at and you think the person might qualify for Medicaid and you can apply for that, that can help with getting into residential care in a nursing home. As I said, a few nursing homes will consider Medicaid. Most nursing homes will be private pay. Most board and cares are private pay. Location is always very important. And this is a big one. People often choose, when I ask families, well, how did you decide to move here? They often say, well, it was the closest, because they want to be connected. If they don't have their loved one at home, they want to be able to visit frequently. They want to still be involved in their lives. And so location is very important. Again, while that's an important factor, I always encourage, as I said, people to look at more than one place. This might be the closest place, but if you went another half mile or mile, there might be a couple other choices, and it's always good to have a comparison. So what type of research have you done? And again, so often people make these decisions under a time of crisis. I was talking about this client, Gary, I had, who he was the caregiver for his wife. He was put in the hospital, and then it became evident that he couldn't continue to be the sole caregiver for her. And so he had to very quickly make a decision to find a place, and he had not looked or visited any nearby places. So I encourage people, even if you think you're not going to, I'm always going to have my mother live at home with me. It's part of my education and increasing my knowledge to at least let's go out and visit 2 or 3 places that could be possibilities. And I'm going to talk a little bit more about how you can use these as kind of adjunct to you if you do have your loved one at home. But if you can visit them when you're not in a time of crisis, you don't have to make a decision. And I encourage you to visit these places several times, because if you visit once, you make an appointment, you show up, they're going to give you a wonderful tour. But I say, what if you said, I'd like to come back in a couple of weeks and maybe bring my mom, and we'd like to have lunch with the residents. So you have a chance to listen, and you have a chance to observe again. And then you might say, well, what kind of activities do you have here? Do you have any special events coming up? I'd like to come back for one of those. So it gives you an opportunity to observe more than once. And again, hopefully, if it's not at a time of crisis, you can gain a lot of information. References, if any of you belong to support groups, if you know any neighbors or friends who've had a loved one living with dementia, what have been their experiences and where do they recommend? That can give you kind of a starting point also and can be very helpful. When you visit a place, again, if I'm visiting, looking maybe for a place for my mother, I say, I look around, I go, is this where I would want to live? And I'm looking not only does it physically look clean and smell good, but does it look like there's joy there? Does it look like there's real life there? Or do I see people lined up in wheelchairs? Do I hear kindness? Do I hear compassion? Or do I see staff walking by residents in a hurry? Do I see staff pushing someone rapidly down the hall in a wheelchair, and the person in the wheelchair doesn't seem to really be engaged with what's going on? Look around you. Use all of your senses. Does it look inviting? Do you feel welcomed when you walk in? What is the communication? What is the atmosphere when you walk in? And again, we want to think of the individual needs of your loved one. I use myself as an example. I love to garden. I hope that if the time comes and I live in a residential setting, I hope they have a garden. And I hope not just to look at it through the window. I hope I can go out there and get my hands dirty. That would be meaningful to me. Maybe could I go out and pick some herbs from the garden and bring them in, and they could be used in cooking. If many of the assisted livings now, or at least some of them, allow people to bring their pets in. If your loved one is really connected to a pet, that can be a very significant relationship for them. And are they able to continue that if they moved in? So what are the special interests? And are those accommodated? Are those things accessible if you're looking at? And again, as I mentioned earlier, you think, okay, I think I've done my research. I think this would be a good location. This would work out. Things might change. Your health needs might change. The health needs of your loved one might change. and you might have to have a plan B. People ask me, what does good care look like? And again, to me, if we're talking about someone living with dementia, if we're talking about someone who's um, near closer to the end of their life, what do we want to wrap them in? How do we want to support them? We want them. I want my people to know my mother. I want people to know her as the kind of uh, you know, spicy individual that she is. And she's probably going to give you her opinion, but she's also going to really appreciate a good joke. And she's going to have a good laugh with you. She loves to play cards. I want people to know that and invite her to play cards with them. So that's the kind of care I'm looking for. I'm not just looking for a place that's going to give her her medicines, and that's important. I want to know that she gets her medicines on time and the correct medicines. I want to know that they'll call me if anything looks amiss. But I also want them to know my mother as kind of the quirky, fun individual that she is. I want a place that's going to talk about the abilities that my mom still has rather than her losses and debilities. When I tour a nursing home or assisted living and I ask the staff to introduce me to residents, I listen to how they introduce me to residents. And do they say, this is Mary. She used to be a school teacher, but she doesn't do much now. In my mind, I'm going, why would you introduce someone that way? Why do I need to know that they don't think that she still has the abilities she used to have? Why don't they introduce Mary as, this is Mary? And, and Mary may be sitting there in a wheelchair and look, quite frail to me, but they could, if they know her as an individual, they can say something about Mary that will introduce her strengths to me. This is Mary. And boy, when we have music on, she is tapping her foot and she is humming along. This is Mary. She has the best smile and she greets people every morning. I mean, what can you say that's positive about someone and still acknowledges their strengths and abilities rather than introducing them or focusing on their losses? I also want to know, what's their program to help maintain abilities and independence? Encouraging people to sit in a wheelchair all day does not encourage them to continue to be independent. If someone has an interest in painting, I want to know, how are they going to make those opportunities accessible to my loved one? So I want to know how they're going to maintain her love and her abilities in that. And I also talk about inclusive models, and this is something that's very common if you're looking at care for a loved one living with dementia, that often you will see in an assisted living or a nursing home, they will have kind of what we used to call a unit or an area at the end of a hallway with locked doors, and behind that is where the people, the residents with dementia live. And that's not an inclusive model. They're confined back there by themselves. And I always challenge places, and I understand safety but I really challenge places to tell me why these 20 people all need to be confined behind these locked doors and they can't come out and have lunch in the more beautiful dining room out front, or why they can't come out and use the front patio, or why they can't come out and listen to the singer that's performing this afternoon. So if there's a separate dementia or memory care unit, you want to look at that and go, is this going to meet the needs of my loved one, or is it going to be too confining? Listen to communication. I've already hit on this a little bit. Are people addressed with respect? Do you see staff taking their time when they approach someone, or are they rushed? My mom, when she was in a nursing home for rehabilitation after a fall, she said, "Oh, I just wish someone would just come in to talk to me rather than always coming in and asking me to complete a task that they needed, to draw her blood, or now it's time for physical therapy, or can you fill out your menu card for the day?" She said, "I just wish someone would come in and talk to me sometimes." And I think that's something to observe and listen as you visit these places. And of course, we're looking for body language. Um, is the Do they approach people with gentleness and compassion? Okay, so if you are considering nursing homes under the CMS federal guidelines, there is a website, and when you get these slides, if you click on that link there, it will take you, and you can type in nursing homes that are close to you and you can compare them. They're going to look, they talk about 1 to 5 stars for a nursing home and ranking it. And they look at 3 main areas: health inspections, is staffing adequate, and different quality measures. And you can see that laid out on this website. If you're considering assisted livings, they are regulated under the California Department of Social Services, and you can click on that link and you can look up assisted livings that you are considering. And they look at these 7 areas there: administration, dietary, nutrition, how is the environment, is it safe, life safety, meaning are there a lot of falls, things like that, quality of care, resident satisfaction, and staff training. So I think this is good information for everyone to have, to know how to go into these websites. But I also do just want to caution you that the rankings on the websites don't always tell the whole story. You need to go in, you need to visit, you need to talk to people, you need to listen and observe. Excuse me. So this can give you some information, but your own visits and observations will be the most important. So as I was saying, I'm recommending, if possible, visit several times. Don't feel bad about asking to come back. Your place looks very interesting to me. I would like to visit a couple more times. What would be a good time? I'd like to come for a meal. I'd like to come for an activity. I think it's often when you visit a nursing home or assisted living, the person you interact with or meet is their admissions coordinator or marketing director or community director. They have different titles for these positions, but their job is basically to give people tours of the facility and hopefully move them in. And if I was moving a loved one in, I would want to meet the administrator, and I would want to meet the director of nursing. I'd want to know, ask them, how are they going to meet the needs of my loved one? As I talked about, using all your senses, observing, are residents active and engaged, or they seem to be sitting around and sedated without any interactions going on? You're going to listen to the communication. On your visits, if you can, talk with other residents and with visiting family members. How long has your loved one been here? What's been your experience? Anything that you would like to share. Both really good things. Tell me some good things about this place. And then again, looking at the individual needs of your loved one, if they need to go outside, if that's important for them, how is that available to them? If you want, and I think it's just a wonderful thing to have intergenerational programs. I think it's great to be connected, continue to be connected to the outside community. What are the outings like? Give me examples, things like that. So the more you learn and the more you visit, the better decision you will be able to make. I just want to touch briefly on what I call the hybrid model. And it's something that I recommend to a lot of people who have their loved one at home, and and even devoted spouses who say, I can do this. I want to be here all the time for my husband or my wife. I go, yeah, but, and they go, I was a single parent. I raised my children by myself. I should be able to take care of my mother by myself. And I'm going, but when you were a single parent, your children also were in school for several hours a day. Maybe they were on a sports team, or they were interacting and gone doing other activities for a while. Maybe you occasionally got a babysitter and went out with a friend. So you did have other resources helping you with your children, even if you were a single parent. Be very cautious about thinking you can do it all yourself. So that what I call the hybrid model is, again, looking at resources in your community. Is there an adult daycare near you that you could investigate? And maybe your loved one, your parent or your spouse living with dementia could spend some time there. A lot of assisted livings will now let interested people come in for a few hours a day. You often have to pay for that in the afternoon. But like my neighbor whose wife loves art, he takes her to an assisted living 4 days a week in the afternoon after lunch. And she does the art program there. She has snack there. Sometimes she does an exercise or dance program there. And then he picks her up for dinner. So she's at home with him, still living with him every day, every night, but she also has access to other stimulation that he maybe wouldn't be able to provide. So that's something to consider when you look at your community resources. Is would an assisted living or adult daycare be an option for part of the time? I just want to mention that my book, Getting Dementia Care Right, which was recently published, goes into much more detail on some of the things that I've touched on today. And it is available in bookstores and on Amazon if you are so inclined. All right, I want to thank you, and I'm looking forward to some questions.
Great. Thank you so much, Anne. That was such valuable information. So if anybody has any questions, please go ahead and type them into the chat box. We do have some questions, and then just a couple thoughts. As you were talking, I wanted to share from my vast experience in assisted living. When you go to check out skilled nursings or assisted livings, go at various times of the day and the week. After 5 p.m. is going to look very different than 10 a.m. And a Sunday is going to look very different than a Tuesday. So you want to get a well-rounded experience to know what your loved one will be, what their weekend's going to look like as well. And then also assisted living or in-home care, skilled nursing, it's a way to enhance a person's quality of life. And it's best to move an individual in when they have the opportunity to enjoy all that an assisted living has to offer versus when they are in a wheelchair from a fall and they can't enjoy activities like they once could. So it's very important to look and be prepared and, not wait until the last minute or not wait until an emergency, as Anne has said.
Yeah.
So those are just my 2 cents I wanted to share. But one question we have is, can you elaborate further on the Lewy body movement? My spouse is not able to join an adult daycare or have a caregiver who could keep up with the constant pacing and movement. And honestly, it drains me as well. Do you have any suggestions?
Yeah. Thank you for the question. And yes, it's very hard to have people experiencing Lewy body dementia to sit or be calm. Very typical that they are constantly in movement and pacing. Nutrition is a problem also sometimes because they're burning so many calories. I would, so if your loved one is at home, I do think you should be able to find a caregiver who can keep up with them. It's like, let's go for a walk. It's, you've got their arm under your arm, and let's go for a walk. If, there are safe environments, taking them out to local parks where if they fall, they're on grass or they have smooth walkways. It's important to let them roam and pace because it can be very distressing and agitating to them if they're not. It certainly can be exhausting, but I feel like that you should be able to find a caregiver who can keep up with them. I'm interested in learning more about what that problem would be. I don't want to mention specific assisted livings, but Lauren, I don't know uh, if how you feel about that, but there are some that do a really good job
Hmm.
with Lewy bodies. And I was just visiting one yesterday, and they have a lot of room for people to roam, and they don't try to confine them. So again, that might be an option for a few hours a day if you can't or don't want to have them reside there full time, is that they are in an environment like that where they can roam and they do have trained staff that's accustomed to it.
Okay, perfect. And then for resources on communities that either specialize in Lewy body or have, to use the term loosely, behaviors that are specialized in that, you can, our All's OC, if you don't mind skipping to the next slide, um, our helpline can offer those resources for you and give you a list of places that, we've verified and support.
That's great.
Um,
That's great because yeah, it is exhausting, and in no way do I want to minimize that person's question, because it sounds like they're trying to meet the needs of their loved one, but it can be exhausting, and you really do need an environment that is and the staff is accustomed to that.
okay, good. We have so many great questions coming in. One person asked, what is the average cost of an assisted living facility?
Yeah. It'll vary a lot because most of these are all privately owned, private corporations, and they will vary their charges. I'm going to say, and within an assisted living, the charges can be different, starting with someone who, if you move in and you're fairly independent and can take care of yourself and take your bathe yourself and go to the dining room by yourself, your charges will be less. But I would say anywhere between 6,000 and 20,000 a month. And that's another reason to shop around. I think
Mm-hmm.
it's not inexpensive, but then home care is not inexpensive either. I When people have financial constraints, as most of us do, I really encourage them to start out thinking of that hybrid model. What can you safely do at home, thinking of your own health and well-being as well as your loved one? And then what are the community resources? Does your local senior center, is there an adult daycare? Or is there an assisted living nearby with a special program that can uh, be meaningful for your loved one in the afternoons or a few hours a day, something like that?
Okay, perfect. And then someone's asking if you could go back to slide 7 if you're considering home care questions to ask. There, perfect. Thank you. And then another question we had is, would board and care facilities be appropriate for those with dementia since they tend to be more independent placements?
Again, board and cares usually do not have nursing on site or often even any nursing supervision. They will have, by state regulations, they have to have live-in caregivers that 24 hours. So again, it depends what the needs are of your loved one. But one thing about board and cares is they're small. And so I would not recommend someone with Lewy body living in a board and care because there's not enough room for them to roam usually. Um, that it can be appropriate for someone with dementia, but again, because every person is going to be unique and have unique needs, you just have to think about that. I don't want my mother in a recliner in front of the TV 10 hours a day. I don't want that. I want her to have other opportunities. So, what do they provide there? It can be hard if they have 6 people living there and only one caregiver to meet the safety and hygiene and nutritional needs of everybody, as well as providing some um, engagement and entertainment and stimulating things going on, which I think are really important to making the day good quality. So you have to look at what the needs are of your loved one.
Okay, perfect. It's actually one more slide back, if you don't mind. Um, Perfect. And then, so how far in advance do I need to start looking for a memory care facility? Are there waiting lists?
There can be waiting lists at some, although that fluctuates. Um, I encourage people, and somebody said to me, "Oh, you're never going to get people to do this." And I go, "I don't care. I'm going to keep saying it anyway." That I encourage people, if you have a loved one that's received a diagnosis, and no matter where they are in their journey, think of this as educating yourself, as educating your loved one, and looking at resources available, and start out investigating early. Uh, you're going to learn a lot. The more places you visit, the more you will learn. And if nothing else, you'll start checking off places going, this place is not an option. I don't like the way it feels in here. I don't like what I hear. So you can check that place off. And then, okay, I've seen 2 or 3 places now that I think are pretty interesting. It looks like they really do provide a good quality of care. Those are the places I'm going to start going back to and visiting. And I love your idea. That was great, Lauren, of visit different times of the day and the week. Um, so not just when they're expecting you, just pop in for a visit. I was driving by this last Sunday and came by, and gosh, it didn't look like I couldn't find staff to ask a question to. I mean, so visit different times and you will learn a lot.
Mhm.
Yeah.
Perfect.
So the earlier, the better is my answer for that.
Mhm. And I think the same goes for skilled nursing facilities. Even if you think I'm never going to need one,
Yes.
when you're in a hospital and they're saying, "Oh, you're going to need to go to a skilled nurse and you can't go home," you want to know which ones you want to go to or you loved one to go to, and you want to advocate and say, "No, I don't want that place that you're recommending. I know I want to go to this place." So just
I
have the
know.
knowledge.
It's a shock to people because I know when my mom was in the hospital, she broke her hip, and she called me and she goes, "They told me I'm leaving tomorrow and I need to tell them which nursing home I want to go to." And it was a shock to her because she thought, well, just like she went to the local hospital when she fell, she would then go automatically to the local nursing home for a rehab. And I go, no, actually, that's much more of a choice. And you're right. The more you know and learn, the better choice you can make.
Mhm. So another question is, what is the best way to convince your loved one to visit a facility when they are resistant to move from their home?
Yeah, that's tough. And so I just describe it as an outing. Um, Mom, I've made an appointment. We're going to go out to lunch. And I hear they have um, a shuffleboard club there, and you're good at that. And I thought it'd just be fun to go visit. So not talking about moving, not talk about this is a social outing, or you could meet with the admissions director and say, I'd love to have my mom come in and visit with me. What's a fun event that you have coming up where maybe we could participate in? So I'd like to bring her in for that. So you make it more like a social event, something that's fun. Um, you could ask, I can do a whole nother series on moving people in and how traumatic that is. And I work a lot with assisted livings and nursing homes because they think, oh, we've got all the information, they're fine. But I always say I'd like to be in touch with a resident and a family that can kind of be a friend. And could we sit with them when we come in for lunch or something? And so make it more of a friendship kind of thing and getting to know someone in there.
Okay, perfect. And then if my sister has long-term care insurance, are there any restrictions that I should know about? And how do they pay out? Are all locations covered?
Really good question. Different long-term care insurance policies will have some more restrictions than others. You need to really open that policy and look at it. Hopefully, it's one that will pay for both in-home care or for residential care, whatever your sister would need. Um, and usually you have to show that you can know that person can no longer independently perform what they call ADLs, the activity of daily living, such as bathing or nutrition or cleaning their environment or cooking their food. They can't aren't able to take their own medications without supervision. So there are certain criteria that you and your doctor can check this off that they are no longer able to fulfill themselves. And then you can look for whatever your policy allows and you feel is best, whether it's in-home care or residential care. If you go to a assisted living or nursing home, you can take the policy with you. They are usually very skilled at helping you differentiate on what would be needed to get your insurance policy to get it started, trigger it to start paying.
Okay, perfect. And then we'll go over the last question. A few people wrote in some great questions, but they're a little bit more specific or not necessarily on topic. So I'll reach out to those individuals at the end directly with some more resources for them.
Wonderful.
Um, and then, so last question is, how do you know when a person needs a higher level of care than assisted living can provide? Example, they're living in an AL, but they need more supervision for toileting.
Okay. Um, Again, most assisted livings in California are allowed to have someone who needs assistance with their toileting. They may, their monthly fee may increase if they have to assist someone with their toileting, but they usually are able to accommodate that. If you're in an assisted living that doesn't allow anyone there uh, that is incontinent or needs toileting assistance, then you'll have to look for another location. But most ALs in California do have what they call their levels of care and can accommodate that. Um,
Mhm.
was there anything more
No,
specific?
that was a question. And I think too, the assisted living will always let you know if they can't meet the needs of the
Yeah,
individual as well.
just
They'll start working with you.
yeah, just one quick word about assisted livings is, when somebody asked what the cost is, and I said it could be start maybe around 6,000 a month, going up to very high 20,000 a month. Um, Often they have what they call their base rate or their general rate, and that's say it's 6,000 a month. But then they will have a menu of additional charges depending anything additional they have to do. If they have to bring in the medications for your mother every day, if they have to escort her or wheel her to the dining room, that's an extra charge usually. If she can't bathe herself or if she needs help with toileting. So all of these things can be additional charges and it can add up quite rapidly. So they may say our charge is 6,000 a month, but it may be closer to 10,000 a month if your loved one does need a lot of supervision and care.
Hmm. And then just to touch on that too, so you shouldn't go into it blind, not knowing the cost. They'll do a pre-assessment before an individual moves in and to give you a sense of what the care would cost because they can quote this, but what actuality of what your mom or dad needs is could be different. Um, yes, I had another thought, but now I can't remember it. But okay, so it looks like that was the last of our questions. Anne, did you have anything else that you wanted to add?
No, only that again, my heart goes out to all of you that if you're trying to support a person living with dementia, I know how complex these decisions are. And I encourage you to be flexible. I encourage you not to try and do it by yourself. Always make a team, get a team together. And the more that you can investigate and visit and learn and ask questions, the more knowledgeable and the better decision you'll be able to make.
Yes. Wonderful. So thank you everybody for joining us today. You'll be receiving a copy of the PowerPoint shortly after this webinar concludes. And for further information regarding resources, please feel free to call our ALS OC helpline. The information will be available in the PowerPoint on the last slide. And please also remember to complete the survey as you're leaving. So thank you all and have a great day.
Thank you. Thank you, everyone. Have a good day.